Hi, my name is Dr. Ford, and today we're just going to go over complications in female athletes. I just had a couple sessions this afternoon where I have very high functioning, high performing female athletes. And one of the risk factors is when you are a female and you're engaging in a high intense physical activity, sometimes you're not having enough intake to support any sort of reproductive mechanism, specifically menarche every single month. And so if you are a female athlete and you've lost your period, what can happen is that will be a sign that you're not having enough intake or you're having more energy expenditure than what your body is used to, and that can delay menarche or delay, I guess not the onset of menarche, but it can delay your monthly cycle. So if that's happening, one sure sign is your energy balance is thrown off. So if it's corrected in 3 to 6 months, it's not going to create too much of an imbalance long term. Over 6 months, you're going to start to see either muscle atrophy or even bone loss. And so you want to make sure, if you haven't had a period in 6 months, you're talking to a provider, potentially a dietitian, potentially an OBGYN, a hormone specialist, anyone that's involved in endocrine metabolism or anything that's involved in talking about cycles at a specialized level. And make sure if you're speaking with a dietitian, they're familiar with disordered eating habits, high functioning athletes, and maybe there's just something that needs to be corrected. Simple adjustments, an extra 360 calories at breakfast, getting enough protein, and making sure there's enough rest and recovery days. As a high performing athlete, you want to make sure that your bone tissue is strong, and not having a monthly cycle will impact your bones. So over 6 months, get checked out. 3 to 6 months, you can start to maybe see interventions where you can improve caloric load and protein status. Okay, hope this helps.